We move on to the developmental disturbances of oral and paraoral structures. Disturbances of teeth can be studied as size, shape, number, structure, and growth. Size of the teeth, the microdontia is teeth which are smaller than normal, which may be either true microdontia, relative, where the jaw size is larger and tooth size is normal, or it can be microdontia involving a single tooth. Macrodontia deals with teeth that are larger than normal, true generalized, relative, where the jaw size is small and the tooth size appears large, and macrodontia involving a single tooth. Shape of the teeth anomalies are seen as gemination, where there is an abortive, incomplete attempt at split of one tooth germ. Fusion, where two separate tooth germs fuse to form one single tooth which is larger than normal. Concrescence, where there is union only by cementum. Dilaceration, an abnormal or abrupt bend in the root. Talon cusp is accentuation of the lingual the papilla seen in the anterior teeth, which resembles an eagle's talon. We have dens in dente, also called as dens invaginatus, caused due to invagination of the tooth germ, giving rise to a tooth within a tooth appearance. Dens evaginatus is exactly opposite to invaginatus. It occurs in premolars, where in between the buccal and the lingual cusp you will have an additional globule or cusp-like excrescence. Such type of premolars are called as Leong's premolar. And taurodontism, where there is an enlargement in the size of the pulp chamber at the cost of the tooth. Depending upon the severity, we have the hypo, meso, and the hypertaurodonts, and some teeth show supernumerary roots. Anomalies of number of teeth. The first is anodontia, where there is absence of teeth. It could be total and partial. It could be true and false. True anodontia deals with total absence or the complete congenital absence of teeth. Such cases will present clinically as a sharp knife edge ridge that is appreciated. Exactly opposite to it is more number of teeth than the normal number, that is supernumerary teeth, occurring more commonly in the maxilla. The syndrome associated with supernumerary teeth is Gardner syndrome, which also manifests as large intestinal polyposis, osteomas of long bones, skull, jaws, epidermoid and sebaceous cyst, and the desmoid tumors. Anomalies of structure of teeth. We have the Amelogenesis Imperfecta, Dentinogenesis Imperfecta, Dentin Dysplasia, regional Odontodyplasia. Amelogenesis Imperfecta is also called as hereditary, brown, or opalescent teeth. It represents a group of hereditary defects of enamel unassociated with any other generalized defect. It is an entirely ectodermal disturbance where the mesodermal component is normal. It occurs only when the injury occurs during the development of the enamel. Once the enamel is calcified, no such defect will be produced. Enamel formation occurs in three stages: enamel matrix formation, enamel calcification, and maturation. And therefore, we have got the enamel hypoplasia, enamel hypomineralization, calcification, and the hypomaturation. Enamel hypoplasia can also be environmental, where the causes are nutritional deficiency, xanthomatous fever, congenital syphilis, hypocalcemia, tetany rickets, birth injury, local infection or trauma, ingestion of fluoride leading to mottled enamel, and the idiopathic. Clinically, it manifests as three cases: mild cases, severe cases, and the extremely severe cases. Mild cases will show few small grooves, pits, or fissures. Severe cases will show rows of deep pits, grooves, and fissures horizontally on the surface of the tooth. And the most severe cases, there will be absence of enamel. Hypoplasia due to congenital syphilis needs a special mention here because they are pathognomic in appearance. They are characteristically seen in the maxillary and mandibular incisors and molars. Such teeth are called as Hutchinson's teeth. Anterior teeth are described as screwdriver-shaped incisors and the posterior as mulberry molars, very classically seen in this photograph. Due to local trauma or infection, the hypoplasia affects only one single tooth. Such a tooth is called as a Turner's tooth or Turner's hypoplasia. Moving on to Dentinogenesis Imperfecta, it is also called as hereditary opalescent dentine. Here, only the mesodermal portion of the odontogenic apparatus is affected, where apibular dentine is deposited, almost completely obliterating the pulp chambers. It can be seen in association with osteogenesis imperfecta, thus classifying into type 1 and the type 2, which is a more rarer type where the teeth are called as shell teeth. Dentin Dysplasia is a rare disturbance in which the dentine formation is by deposition of a typical dentine leading to abnormal pulpal morphology. Here it is classified into type 1, which is the radicular type of dentin dysplasia, and type 2, which is the coronal type of dentin dysplasia. The roots in this condition are extremely small, and hence it's called as rootless teeth. Regional odontodysplasia deals with, it is also called as Odontogenesis Imperfecta. Here there is a sparse or no dentine deposition which is seen. The enamel is normal. Radiologically, such a tooth will appear as a radio-opaque outline form of the tooth. Thus, it justifies the name given to it, that is ghost teeth. Disturbances in growth or eruption of teeth, either there will be premature eruption or delayed eruption. Multiple unerupted teeth are also encountered, as in case of hereditary ectodermal dysplasia. Unerupted teeth could be either embedded teeth or impacted teeth. There is a difference. Embedded teeth are those teeth which do not erupt due to lack of eruptive force, and the impacted teeth are teeth unerupted because of some obstruction by some mechanical obstruction. Developmental disturbances of soft tissues deal with tongue, lips, cheek, gingiva, soft palate, and salivary gland. The tongue lesions are many. Let us see each one. Macroglossia is a tongue which is large in size, almost filling the whole oral cavity. Microglossia is a small rudimentary tongue which is a congenital anomaly. This tiny tongue poses a lot of difficulties in speech and swallowing. Total or complete absence of tongue is an extremely rare condition denoted as aglossia. Cleft tongue is also called as bifid tongue because there is a cleft running right across the entire length of the tongue, dividing it into two. Another condition is called as ankyloglossia or tongue tie, which exhibits a short lingual frenum which is very anteriorly attached. Fissured tongue deals with grooves that vary in depth and which are seen traversing from a central groove laterally, giving it named scrotal tongue. It is, in fact, a lot of food lodgement and irritation is encountered in this case. Geographic tongue is also called as benign migratory glossitis or erythema migrans. Here you encounter red, depapillated, irregular areas showing a white hyperkeratotic irregular margin, and they keep changing places from over a period of time, hence the name benign migratory glossitis. Median rhomboid glossitis is also called as central papillary atrophy or posterior lingual papillary atrophy. It is a diamond shape or a rhomboid shape depapillated area seen in the posterior 1/3 portion of the dorsum of the tongue, just anterior to the foramen cecum. And it is also called as posterior midline atrophic candidiasis. Lingual thyroid nodule is an accessory accumulation of thyroid tissue that is functional, and before removing it, presence of normal thyroid should be confirmed. Lingual varicosities are varicose veins that are seen on the ventral surface of the tongue. Black hairy tongue is a commonly observed condition where there is defective desquamation of the filiform papillae, or there is an abnormal excessive elongation of the filiform papillae. A lot of food debris and accumulation of desquamated epithelial cells occurs, and the black color is because of the colored food ingredients and the chromogenic microorganisms. Commissural lip Pits and fissures are mucosal invaginations that occur at the corner of the mouth or the vermilion border. They may represent a failure of normal fusion of the embryonal, maxillary and mandibular processes. Double lip is a redundant fold of tissue that is seen on the mucosal aspect of the upper and the lower lip. The cleft lip and cleft palate are encountered in newborn infants. The etiology may be monogenic, where a single gene may be the defective gene giving the clinical manifestation, or it could be a polygenic etiology where multiple genes have to be defective to reach a particular threshold for clefting to be clinically manifested. There are other factors which are also responsible for clefting, and they are defective vascular supply to the area, mechanical obstruction because of large tongue, circulating disturbances, circulating substances like the alcohol or the drugs or antibiotics, infection, lack of inherent developmental force where the two halves can unite. Clefts can be either exclusively on the lip, or most commonly it usually involves the alveolar process as well as the palate. It could be unilateral or bilateral. Developmental disturbances of buccal mucosa are in the form of diasis granules seen as yellow papillary lesions on the cheek mucosa due to presence of ectopic sebaceous glands, and leukoedema, which is a normal variation of mucosa seen as a translucency on the buccal mucosa. Developmental disturbances of the gingiva, we encounter hereditary gingival fibromatosis, which is an idiopathic condition. It could be localized or generalized. It appears as a developmental type of phenomena. There is an exuberant overgrowth of the gingival tissue, almost covering the entire crown surfaces. Disturbances of the salivary gland like aplasia, atresia and aberrancy usually lead to xerostomia and mucositis of the